Okay, knock on the door, wash my hands. Hi, my name is Kim. I am a student nurse with Oakland Community College, and I am here to assess your newborn to make sure that everything is fine with your baby. Can you read me the number that is on your wristband? They match. This is definitely your baby. So I'm going to put some gloves on. I've already washed my hands. So in this instance, we're going to warm the environment. So I'm going to place the baby in the radiant warmer with the warmer turned on. I'm also going to make sure that the room is warm. There's no drafts. We have the warmer away from the door. And we'll temp the baby beforehand to make sure that the baby is an adequate temperature for an exam. So the first thing we're going to do is assess the apical pulse of the baby. So I use my stethoscope, and I would listen to the baby for 1 full minute, counting the beats. What we're looking for here is a heart rate between 110 and 160, 105 if the baby is asleep, 180 if the baby is crying. We want a regular rhythm, and if you hear a murmur, it's usually not a big deal, but you still want to report it. Next, we're going to assess the baby's respirations. So I would count the baby's breaths for a full minute. And what I'm looking for here is 30 to 60 breaths per minute. The baby should be breathing, can be breathing in an irregular pattern, and pauses of up to 10 seconds are actually totally fine. What would be a sign of respiratory distress, though, would be tachypnea, like rapid breathing, grunting, retractions, or circumoral cyanosis. And those would all mean that we need to do some interventions to help this baby breathe. Next, we're going to take the baby's temperature. It's going to be taken in the armpit. You want to make sure you put the probe right in the middle of the armpit and then close it and hold it down tightly so that it gets a good reading. And when the reading comes up, it should be between 36.5 degrees C and 37.5 degrees C. Anything below 36.5 would mean the baby needs to be warmed immediately, and skin to skin with the mother is the most effective way to warm the baby. Next, we're going to assess the baby's body. So we want the baby's tone to be flexed with good muscle flexion that resists a little bit. We don't want any limp noodle babies. We also want the baby to be moving randomly with good activity levels. So that would all indicate healthy newborns. As far as the skin goes, if the baby had blue hands and feet, which is acrocyanosis, that would be acceptable within the first 24 hours of life. We want the baby to look pink and well oxygenated. Otherwise, we can press the tip of the nose, blanch the skin. If it's yellow, baby is jaundiced. If the jaundice was in the first 24 hours, that would be serious. Other than that, it would just be physiologic jaundice after 24 hours and would probably just go on its own with regular feedings. After we've assessed the body and the skin, we're going to move to the head. So to assess the fontanelles, the baby would be in a semi-sitting position. So you would hold the baby like this, because we want to support their head at all times because they can't do it themselves. Palpate the fontanelles. You want them to be soft and slight, like minimal depression is okay. Right here. But if it was like deeply depressed, that would be a sign of dehydration. You also don't want to assess the fontanelles while the baby is crying. And then you're going to assess the head for the caput saccadium, which is edema of the head. That would cross the suture line, so it could be everywhere. It's from birth trauma, so it usually goes away within 12 to 48 hours after birth. And then you would also be checking for cephalohematoma, which is bleeding between the periosteum and the skull, which would just be on one side of the head. So you wouldn't see it cross the suture line. It would just be on one side. and that would drain by itself within 6 weeks. So you would make note of those if you saw them on the baby's head. Next, we're going to palpate the baby's clavicles gently. If we were to feel crepitus in either one, that would indicate a broken clavicle. We would notify the provider, and we would pin the baby's sleeve to their shirt so they would immobilize the arm while the clavicle was healing. After assessing the clavicle, we're going to go ahead and assess the cord. So the cord would get clamped immediately after birth, and it would start to dry out. Within 24 hours, it's dried enough that you could remove the clamp. What you're looking for here is there shouldn't be any redness or swelling or purulent drainage from the cord stump. It should be, it can be black, but it should be dry and not irritated. You can fold the diaper down below the cord so that it doesn't get like friction, and that helps it stay nice and healthy. So we would assess the cord site and make sure that that does not look infected. And again, the redness, drainage, foul odor, like those would be signs of infection that you would report to the doctor. Now we're going to assess the baby's back. So we're going to palpate the vertebrae for the baby all the way down, feeling for holes. Any spaces could indicate spina bifida. You want to look for if there's a sac on the back with like meninges in it. That would be another bad sign that you would want to report. You also want to know if there is the pilonidal dimple, which would be all the way down here. So you would note that in your report. I also want to remember that I forgot to auscultate the baby's lungs earlier, so I'm going to do that right now. So when we're auscultating the baby's lungs, we are making sure that the majority of that amniotic fluid is out of the lungs and that the baby is breathing air and isn't having a bunch of fluid in its lungs that could cause pneumonia. The next step we're going to move on to assessing is the baby's genitalia. If this was a female baby, the labia majora would be fully covering the clitoris and the labia minora. If it wasn't, that could be an abnormality, or it could just indicate that the baby was preterm. If this was a male baby, the scrotum should have like the rugae, like the crinkly skin, and you should be able to gently palpate the testes. If it doesn't have those, that would be a minor abnormality, or it could indicate that the baby was preterm. As far as the penis, the urethra opening should be right in the middle. It shouldn't be high or low. So a normal finding would be right in the middle. Next, we're going to check the baby's reflexes. First one we want to check is the Moro reflex or the startle reflex. So baby should startle. That's good. We're going to check the grasping reflex. So finger in the hand, baby's hand should close around it. That would be good. Rooting, you would touch, baby should turn to your finger. For suckling, you would place a gloved finger in the mouth, or you can use a pacifier. Baby should suckle. You can check their plantar reflex. Choke there, toes should curl in. Babinski, you go up the side and over. Toes should spread out. Tonic neck, the baby lays down, their neck should turn, one side or the other. And then the stepping reflex, you want to support the baby's head, but it should do a little dance. After we've done all those checks, it would be time to start teaching parents, first thing you want to teach is cord care. The cord obviously is drying and then it's going to fall off. So you want to make sure the parents know that they can't submerge the baby until the cord is fallen off. So sponge baths only until the cord is gone. You also want to keep that diaper folded down to reduce irritation. The next most important thing you want to teach the parents is safe sleep. Baby should be alone on their back in the crib. You swaddle them, swaddle their arms up and out so they could still startle. It's a life-saving reflex. So that's something you would want to teach the parents. Next is feeding. The parents breastfeeding. You want to feed 8 or more times within 24 hours. Obviously, if the baby's giving you hunger cues, offer the breast. See if they want to eat. It's okay to feed them, not on a schedule, and more than 8 times in 24 hours. Cluster feeding is a thing. So don't feel like you're feeding your baby too much. The best way to tell your baby is gaining weight is by diapers. So we're getting enough to eat is by diapers. So you want 1 urine, 1 stool within the first 24 hours. Stool will be black and tarry, that's the meconium. By the time they're 4 days old, you want at least 6 wet diapers, 4 poopy diapers, dirty diapers, stool diapers by 4 days of life. So anything less than that, you'd want to monitor, maybe talk to the pediatrician. And by that time, the baby will be having milk stool, which is yellow, seedy stool. If you have any problems, the things you'd want to call the pediatrician about is a fever over 100.4 degrees. If the baby is vomiting their entire feed, watery diarrhea, blisters or rashes, or a sudden change in behavior, like extreme lethargy or something, those are all things you want to call the pediatrician about. If the baby's choking, you're going to want to angle them downwards. Hard blows to the back. Get that out. Finally, it's very important. Baby needs to be alone on their back and in the crib. So, assessment and teaching all done. I'm going to hand the baby to mom. We're going to be doing skin to skin. So we want to make sure that the baby's face is always visible during skin to skin. That way they're not pressed into you and not breathing. I want to make sure that their nose is open to air and that we cover the back of them with a blanket. So we're going to put the baby alone on their back and in the crib. Remove gloves, wash hands, congratulate the parents, let them know I'll be back if they need anything.